Welcome, Joslyn Center Facebook Live fans. This is Jack Newby. I'm Executive Director of the Joslyn Center, and we're happy to welcome you to our Interview Friday. So we are on our way. Before we start with our interview, I want to talk a little bit about what's happening here at the Joslyn Center. We have coming up our health fair. That's coming up on October 26th from 9 to noon. And that is presented by Desert Oasis Healthcare and sponsored by Eisenhower Health. And free COVID and flu shot vaccinations will be there, as well as screenings for blood pressure, glucose, BMI, also stroke screening and education. So a lot of interesting things for you, and about 30 vendors will be there to provide you information, and they will also be talking to you about what we're going to be talking about today, the open enrollment for Medicare. We also have coming up another vaccination clinic, and that is sponsored by Desert Healthcare District, and that's coming up on Friday, October 13th from 9 to 10:30 a.m. And that's in conjunction with our senior farmers market. We have Penny's Pantry on one Friday, and we have Senior Farmers Market on the other. So that's coming up with, along with our Senior Farmers Market, and that is COVID-19 vaccination, flu series, flu vaccination, both primary and booster for COVID-19, and also one that's new and that we're just hearing about is the RSV, or respiratory syncytial virus. I probably pronounced that wrong, but so that's another one. So you can get vaccinations, and on the 13th, there's a $20 gift card when you get vaccinated. So that's an extra incentive for the vaccination. Also coming up here at the Joslyn Center, a few more things we want to talk about. Our Art and Soul painting with Marcia. Sign up at the front desk. That's on Mondays from 10 to noon. And so classes resume on October 9th. Also, Eisenhower Health is doing managing stress as a pillar of health. And there's so many studies that tell us about stress and how that impacts our health. So that's really important. So that's on Wednesday, October 11th from 10 to 11, and that's online via Zoom. So you can check out our email newsletter for that information, or give us a call at 760-340-3220. And you can ask for Melanie. She's at extension 102. Also, this is really coming up a lot. And beware of scams, and that's being presented by First Foundation Bank. So they're providing the information on the latest scams that are affecting older adults, and that's on Wednesday, October 18th from 10 to 11. And there are so many new scams. You need to hear about the ones that are powered by artificial intelligence, and they're really scary because they bring up people that sound just like your relatives. So you really want to be careful when you open up any email. If someone asks you for money on the phone, just say no. And then we have our Halloween cookie baking with Rona and Taria, and that's on Thursday, October 19th from 10 to 1. So there's a lot happening at the Joslyn Center. We invite you to come and get involved. 760-340-3220 for information, or visit our website at Joslyn, Joslyn Center.org. So that's what's going on here at the Joslyn Center. Let's start our interview, and that's with Julie Sarmiento from Bilhartz Desert Insurance. So Julie, there you are.
Good morning.
Good morning, welcome.
Thank you.
So for you, you work for Bilhartz Desert Insurance, one of our business partners and supporters and board members, but also one of the leading insurance carrier or agencies for Medicare Advantage plans and information about Medicare. And we're entering a very important time. And what is that called?
It's called Annual Enrollment Period, or AEP. And this is the time of year that folks can basically do a few different things. So if you're on a Medicare Advantage plan, you can change to a Medicare Advantage plan. And actually, you can make several choices during this time. And the last choice that you pick is the one that's going to stick. So I don't advise you to go and make a bunch of different choices. Sit with an agent, preferably me, and let me let me sit and do a medication review with you, learn who your doctor is, and I'm going to help you make that educated decision. So you only have to do it once.
Well, and that's one of the important things, because whatever you do, that's your healthcare plan for the next year.
That's right.
And so even if you're happy with the one you have currently, there might be reasons you want to change.
Absolutely. Absolutely. And yes, and you're absolutely right, because things change in your life. Your health changes, your medications can possibly change, your finances can change. So there's lots of different areas in your life that can change over the course of a year that warrant taking a look at what your current Medicare Advantage plan is. So that's one area. Another is those of you who have a Medicare supplement and a drug plan. And I do talk to a lot of Joslyn members who are in that situation. So for you folks, annual enrollment period, AEP, from October 15th to the December 7th, this is the only time of year that you have to change your drug plan. You don't get another time. So it's really important for you folks to take a look. And, on some of the prescription drug plans, we call them PDPs, the premiums have gone up. Some people tell me, oh my gosh, the premium went up $20 or $30 a month. Okay, well, guess what? We need to take a look at that. And again, I can take a look at take your medication list and put it into a program that we have called My E-app, and see what plan is available that's going to best suit your needs, and cover all your medications and so on. Another area that for folks that we can look at, there are folks that only have Part A and Part B, just the Medicare card only, and they've not done anything else. And I come across those folks. And so this is the time of year that if you just have Medicare Part A and B, you have that red, white, and blue card, Medicare health insurance card, this is now your opportunity to get on a plan, be it a Medicare Advantage plan or a prescription drug plan. This is your time of year to be able to do that. And also, Blue Shield is opening up an opportunity to get on a Medicare supplement if that's the route you're looking to possibly go.
So let's back up a second, because we're talking about all these parts of Medicare, and it can be confusing.
It is confusing.
What we call traditional Medicare is Medicare Part A and Medicare Part B. Part A, you have to sign up for when you're 65.
Right.
No choice. Part B, and so many people now are employed. So as long as you have, and I forget the term, it's good insurance.
Okay. As long as you have what's called credible coverage.
Credible coverage.
Mm-hmm.
So if you have that, you can put off signing up for Medicare Part B and the other things.
Yes.
But Medicare Part B basically covers your medical visits and those sorts of things. But there's also a pretty hefty copay on that.
Yes. So when you have just when you have just the traditional Medicare, so like you said, yes, Part A is your hospital. And so if you have worked at least 10 years of your life and paid into Social Security, at least those 10 years, or we say 40 quarters, you've technically earned the Part A. So there's no cost to you to have Part A. So yes, when you turn 65, you definitely want to get on Part A, and you have it. And then if you're on an employer plan and it's the credible coverage, you can stay, right? Just have the Part A only. And then when you're ready to retire and go off that employer coverage, then you can pick up the Part B because you're going to pay for the Part B. Well, there's no sense paying for the Part B while you're on an employer plan.
Right.
There's no reason for that. So yes. But if you have traditional Medicare and that's all you have, there are huge financial gaps in that coverage. You have a huge deductible for the Part A this year at $1,600. Part B, the deductible is $233, plus you're paying 20% for all your medical. So with a Medicare Advantage plan, it goes in and it picks up those deductibles plus a lot of that 20%.
So that's
Plus-
really important for people
Yes.
to understand.
Plus a Medicare Advantage plan will also give you a Part D, the medications. Because traditional Medicare does not have Part D.
Now, let's say I'm cruising along. I'm happy with the plan I had. I haven't had any problems. Do I still need to look at and talk with someone like you for advice?
Yes and no, it depends. I mean, for example, I sent out about 200 postcards to my clients that some that I hadn't touched base with for a few years, and some that were my PDP clients. I've gotten communications back from them, and some of them are saying, I feel like I'm good. My medications are the same. Either through a text message or we talk on the phone. I'm happy with the plan. It's working well for me. Thank you for reaching out. I said, okay, we're good for the year. We don't have to meet up. And that may be perfectly fine for you. If you've not had any changes in your medical status, your medications, and you feel like everything is working well for you, stay where you are.
But sometimes things change. You may be happy with it, but it will change. As I understand, if there are changes, people get an annual notice of change that's mailed to them. So
True.
Don't think it's junk mail.
Right. And you need to, yes, thank you. And yes, you do. You need to look at that. It usually comes around the end of September. It's called the annual notice of change, or we like to lovingly call it ANOC. Look for that. And that will tell you what the changes are in your plan. And take a look at it and see how does it look different. And if you see some significant numbers, there's a couple plans out there where there's going to be hospital copays in the plan for next year, where there hasn't been for years. There's a couple plans where the max out of pocket, one plan, the max out of pocket's gone from $2,900 up to $8,900.
Wow.
You need to take a look at that. So pay attention to your annual notice of change. That is very important. So
that's something that a lot of people may miss because we get so much junk mail these days. So really be on the lookout for that. Because you may be happy with your plan, but your plan might not be happy with you, may make changes that you're really not aware of.
Right. Yes. And you are getting a lot of mail this year because everybody's out there trying to, get your business, and, it's that time of year. And I will tell you too, I hear all the time from my clients about the phone calls. Folks, those phone calls are illegal. It is illegal for me to call somebody who is not one of my clients. Just saying, it's illegal, but they do it anyway. So.
Well, and we're inundated not only with phone calls from people we don't know, and the mail you mentioned. I know, I'm of that age, so I'm getting tons of mail right now.
Yes.
And also the television ads, call this number now. So
I'm glad you touched on the television ads. I would like to really point out, work with a local agent. If it's not me, I hope it's me. But if it's not me, please work with a local agent. And if it's not me, and I'm going to please put this out there, work with another Bilhartz agent. And the reason I say that is because we've been trained by the best. We've been trained by Brian Bilhartz, okay, for one. And we are going to make sure that we keep you with your doctor, and we keep you, we're going to find the plan that's going to give you the lowest medication costs. When you call one of those 800 numbers, they know nothing about you. They don't know where you live. They don't know your doctor. They know nothing about Desert Oasis. They know nothing about Eisenhower or any other medical group here in our valley. And they don't care. All they care about is the sale. So a lot of times when folks call these numbers, they get put somewhere, they lose their doctor, they get in a medical group that's in Hemet. I've seen it happen with my own clients. So I just tell people, don't call those 800 numbers. Just do yourself a favor, don't call them.
It's important, stay local. And, Brian, I've known him for a long time, and, he is the encyclopedia regarding Medicare and Medicare Advantage and all the different permutations
Yes.
that are involved. So if someone wanted to talk with you or a Bilhartz agent, how would they get in touch with you?
Well, you can get in touch with me. I know my information's at the center. It's Julie at bilhartzinsurance.com, or my number is 760-835-1651.
And that's Bilhartz. I hope I don't get that wrong.
It's one L. Yes. Bilhartz. I always tell people it's one L. It's his last name.
So that's bilhartzinsurance.com, or your number again?
760-835-1651.
And this open enrollment time, what is that? Because that's the time you have to make any changes.
So it starts, basically I can start writing plans October 15th through December 7th, but it has technically started now. So now, since October 1, I'm able to look up people's medications. I can create accounts, which I've already started doing. I'm setting appointments. So it now is the time. So It is happening now. I will tell you folks, I'm in the newsletter. There's cards at the center. So if y'all would like to set an appointment, you will find me.
Okay.
Okay.
So real quick, do you want to do a plug about that other thing you're doing?
Oh, certainly. So, so my other hat that I wear is, the garden club. And so we basically started a garden club this summer, and, the city of Palm Desert, basically gave us 4 garden plots at the San Nicolas location. So if you're not familiar with that, if you took a walk down, at the end of Catalina and San Pablo, those garden plots are right across the street. And so 3 ladies and I, we have planted all the seeds. And right now what we're doing is we're taking turns and we're going over and watering each a day. We still, could use volunteers to come and help us do that. So, and we planted an array of vegetables from carrots, onions, beets, green beans, broccoli, cauliflower, Brussels sprouts, all sorts of goodies, peas, all sorts of stuff. So
if people want, excuse me, if people want to get involved with that and exercise their green thumb, they can contact our program director here, Melanie Lyons, at 760-340-3220, extension 102. Talk with her about that, exercise their green thumbs, get involved with this, because what a wonderful way to get fresh fruits and vegetables, which are the healthiest you can get.
And somebody had suggested to me, I actually had a conversation with a gal a couple of days ago, and she said she wasn't interested in the vegetable gardens, but she was interested in learning more about houseplants. So what I had suggested to her was, because of enrollment time for me personally, I won't be doing any classes during October, November, December. It's just mainly maintaining the garden. But after the first of the year, so I suggested to her to talk with the people, the gals at the front desk, and start a suggestion class. Just make a list and start a suggestion class, because I'm looking at, after the first of the year, we get back to our classes. I'm looking at doing field trips. But that was a class, house plants, how to keep our house plants alive and that sort of stuff. So I'm open to suggestions and whatever anybody would like to do. So that was a class that she's interested in. So I told her, absolutely. So if any of you have ideas for it doesn't have to be just about the vegetable garden. It could be other ideas towards gardening as well. So
I could definitely use the houseplants one. Excuse me.
So yeah.
Julie, I want to thank you for joining us today. Give us your number one more time.
It's 760-835-1651.
And that's Bilhartz.
Julie at bilhartzinsurance.com.
So I want to thank you for joining us. Let people know this is the time you really need to pay some attention to your Medicare plan if you're on Medicare. And Bilhartz Desert Insurance is a great place to go. So
thank you.
Thank you for joining us. Everyone have a great weekend. We will see you next week on Interview Fridays with the Joslyn Center. Have a great weekend and bye-bye.
Bye-bye.